Hi, I'm Dr. Masooma Merchant. I'm a gynecologist, obstetrician and a laparoscopic surgeon. I practice in South Bombay. My clinic is known by the name of Mom Clinic, situated in Nagpada. Today I'll just be talking about the routine checkup with an obstetrician during your pregnancy. The first thing that you miss your period, you would do a pregnancy check at home by buying a urine pregnancy kit which are available over the counters. You would use your first urine sample, approximately 4 to 5 drops, put it into the kit and check for 2 lines. The kit has a C and a T mentioned on it. A C would come, the C would have a line invariably, and if your pregnancy is positive, there would be a line on the T as well. It is important to see that the C and the T line are of the same color. Sometimes in very early pregnancies, the T line would be slightly less than the C, or sometimes if there is a chance of a tubal pregnancy, that is an ectopic pregnancy, the T line would be a lighter shade than the C line. Once your pregnancy is positive, you go and see your obstetrician. The obstetrician, to confirm pregnancy, might do a beta HCG blood report. This blood report is usually done when you say that your pregnancy kit did not show 2 lines of the same color. At that time, if you're suspecting you to have a tubal or an ectopic pregnancy, at that time what we do is we do 2 beta HCG blood reports which are done at 48 hours apart. Now the routine is that the 2 beta HCG blood reports 48 hours apart would double. If it is not doubling, there are 2 possibilities. One, that your pregnancy is not growing well. Second, that there could be a chance of a tubal ectopic pregnancy and immediately it needs to be looked into. If your 2 beta HCG report 48 hours apart, the second report is lower than your first report, there are chances of having a pregnancy loss. Another way to figure out the pregnancy is by doing a sonography. Now every visit that you do with the obstetrician, every visit would have a regular blood pressure check and your weight gain. The blood pressure normally ranges between 110/60 to 130 by around 80. The weight gain is divided into trimester wise, that is the first 3 months, the second 3 months and the third 3 months, which covers up your 9 months of pregnancy. In the first 3 months, we expect you to have a weight gain of around 1 kg, which sometimes may not be possible because there are a lot of complaints of nausea and vomiting in the first 3 months of pregnancy. The next 3 months, a weight gain is approximately 5 kg, which we calculate as around 1.5 to 2 kgs per month. And the last 3 months similarly again will be 5 kgs, calculated the same way. So the total weight gain in pregnancy is approximately 10 to 12 kgs. Another thing on the first visit that you have with your obstetrician, basic blood test would also be done. In the basic blood test we do is a CBC in which your hemoglobin is checked. Now a normal range of hemoglobin would be somewhere around 10 to 12. If you're lagging or there's a low hemoglobin, then further testings might be required. In the further testings, we usually do the iron studies because it's the most common cause of having low hemoglobin in Indian scenario, and accordingly the iron tablets are added. If the hemoglobin is quite low, which is around less than say around 7, then a hemoglobin electrophoresis is done, HB electrophoresis. In that we check out whether you're not suffering from thalassemia or sickle cell anemia. If there are any chances of thalassemia, be it major or minor, the husband's report for the same to check thalassemia is also done because these traits could pass on to the baby. Another thing in the blood report that we check is your blood group. Having a positive blood group keeps you on the safer side. If you have a negative blood group and it's your first pregnancy, we just check the husband's blood group. If positive, then post-pregnancy certain injections are to be taken. If this is your second pregnancy or more than that, and if your blood group is negative and your first child was of positive blood group, then we do something called as an RH immunofactor, which is to see whether you require any sort of injections during pregnancy. We also check for TSH, which is your thyroid. In the TSH, the ranges are different from a regular person. In pregnancy, the cutoff levels are lower. In your first 3 months, the cutoffs are between 0.2 up to 2.5, whereas in your from the 3rd month to the 9th month onwards, the cutoff is something between 0.3 to 3. Another thing which is checked out is VDRL, which basically tells us the idea of syphilis, if you're suffering from syphilis, and that could be treated at that time. Blood sugar is a very important thing that is to be checked in pregnancy in your first visit itself. We could also do something called as a DIPSI test, in which 75 grams of glucose is given to the patient, and after 2 hours your blood sugar level is checked, a cutoff being around 140, or we could just do a random blood sugar. Another thing which is done is your urine routine, which is again important because any sort of urine infections could also lead you into preterm labors. Another very routine test to be done and should be done in the first visit itself is your HIV, hepatitis B and hepatitis C. It keeps you as well as your doctor safe. And if there's any positive results in any of these 3, you could also be started on treatment immediately to keep your baby at safety. During the first visit, we also do a routine vaginal examination. In that, basically we're looking out for the length of the cervix, which is the mouth of the uterus. Also, if the cervix is loose or it has already been opened up for any reason, as well as we come to know the approximate weeks of pregnancy by palpating the size of the uterus. At your first visit, we ask you to do a sonography. The first sonography we usually recommend at around 7 weeks, because at 7 weeks the baby's heartbeat, that is the cardiac activity, is seen. Then the visits basically go on as every monthly there will be a visit up to your 8th month. From your 8th month onwards, it is a bi-weekly visit, and then it is a weekly visit. Now the next visit that you will be having would be at around the 3rd month, which is between 10 to 13 weeks of pregnancy. At the 10 to 13 weeks of pregnancy, other than the routine blood pressure, the weight that we check, from the 14th week onwards, we could also listen to the baby's heartbeats. You could hear the heartbeats at your obstetrician's clinic using a fetal Doppler machine. At 10 to 13 weeks, we recommend you all to do a test which is called as the obstetric sonography with an NT scan. Your NT stands for the nuchal translucency, which is a very important test, which is a very important sonography that you all should do. It basically measures the nuchal translucency, which is a thing around behind the spine of the baby. Also, the nasal bone measurement is done. Along with this test, we recommend you to do something called as a dual marker. A dual marker is a blood test which is done to pick up any DNA problems in the baby. They mainly pick up 3 chromosomes, that is chromosome number 21, 13 and 18. These are the most common 3 chromosomal abnormalities which we see in the Indian scenario. So your dual marker and your NT scan are integrated together, and comparing both of them, we come to know whether your baby is at any risk for having any sort of DNA problems. Then further testings are recommended, which I will speak to you in a bit. That is your 3rd month scan. Then coming to the 5th month. 5th month, I mean somewhere around 17 weeks to approximately 20 weeks. At this time, another scan is done, which is called as the sonography OBS, along with an anomaly scan. This is one of the most important sonographies that is to be done in your pregnancy. In this sonography, the entire baby is screened from top to toe so that any sort of deformity in the child is picked up. Now, if you have missed to do your dual marker in your 3rd month scan, another option given to you is to do a quadruple marker or a penta marker in this period, that is your 5th month of 17 to 20 weeks. Any anomaly or any problem that is picked up in these, again in the DNA marker test or your scan, then you're recommended to do further testings. Now, what I mean by further testing is, in your 3rd month, if your scan or your dual marker has shown any sort of problem in the baby, then you have 2 options. One is a CVS, that is a chorionic villus sampling. In this, under sonography guidance, a needle is poked through the abdomen and a bit of the chorionic villus, which is a part of the placenta, is picked up, and that is sent for testing. In that bit, the baby's DNA is separated, and each and every DNA of the baby can be screened, and you will get 100% confirmation if your baby actually has any sort of DNA problems. The dual marker, quadruple marker, which I spoke about, these are not 100% accurate tests. They are approximately 95 to 97% accurate, whereas this CVS is a 100% accurate test, but it is a little invasive test. Another option that you have, which is a new upcoming test, is called as an NIPT. It is the non-invasive prenatal testing. This can be done from the 10th week onwards. In this test, the mother's blood is picked out, the mother's blood is taken, and from that the baby's DNA is separated. Then the baby's DNA is rechecked for all the chromosomal abnormalities that could be possible. This is approximately 99.9% accurate, and I would suggest it being a safer test because it is a non-invasive test. Another thing is, at the 5th month, if any problem has come up and you had missed out your 3rd month scan or your 3rd month dual marker, and your 5th month has picked out any sort of abnormality, then at that time another option that you have other than the NIPT is to do an amniocentesis. The amniocentesis again is done under sonography guidance, where a needle is again put into the abdomen and the fluid around the baby, the liquor, is picked out. Now this liquor does contain the baby DNA cells. So again the DNA is screened for any sort of abnormalities. If all good, then we can continue the pregnancy. Now at the 9th month, when you reach around 37 weeks, we would recommend you to repeat a CBC to recheck your hemoglobin, because we still have a month in hand and we could correct it at that time. If your initial blood sugars were abnormal, then in the 7th month we would recommend you to repeat your blood sugars that is around 28 weeks. Whereas in the 9th month, a routine blood sugar, hemoglobin recheck, and a thyroid would be done again. Another thing at the 9th month at 37 weeks is to do a sonography with a color Doppler. The color Doppler basically shows the blood flow to the baby, and at 37 weeks these are the routine tests which are done. If you cross your date, that is if you cross 40 weeks and above, at around 40 weeks we recommend you to repeat a sonography with a color Doppler, so that we know that you're safe enough to be prolonged a week or 2. Max to max we can go up to 42 weeks, so that is 2 weeks above your due date. Now just speaking about the basic medications that are to be taken during pregnancy. In your first 3 months, the only medicine that is required is actually just folic acid. Folic acid nowadays is given in the active form, which is L-methylfolate. And once you finish your first 3 months, we don't usually recommend iron in the first 3 months because of a lot of nausea and vomiting problems. So iron is usually not given in the first 3 months unless you're very low with your hemoglobin. Once you complete your first 3 months, from the 4th month to the 9th month onwards, there are just 3 medications that you need to take, which is your iron tablet, your calcium supplement, as well as a protein powder which would help in the growth of the baby. So this is the basic thing of a routine checkup during your pregnancy. So I hope you'll have a safe pregnancy and you'll understand the reasons of these tests that we recommend you to do. If there is any sort of query or if you need to get in touch with me, you all can connect me through lybrate.com. Thank you.